Let's talk about dementia, delirium, and confusion. So a number of different things are going to influence people's abilities to function. Of course, overall health. Typically, the greater your overall health, the better you're going to be able to function. The number of stressors present at any given point in time is important because stress compounds on itself. So if you are already under a certain amount of stress, any additional stress is going to make your functioning that much worse. There are some different things that contribute to cognitive disorders. We see some changes in the actual transmission between nerve cells in the brain itself. If you have a vascular disorder and you have poor blood flow, of course your brain is not getting the blood flow it necessarily needs, so this can contribute to a cognitive disorder. There are several different medical disease states that can contribute. Poor nutrition as well, and structural brain changes. So anything that changes the actual structure of your brain or the ability of your brain to function, like malnutrition, is going to impair your cognitive abilities. So dementia is a general term. It describes a group of symptoms such as loss of memory, judgment, language, complex motor skills, and other intellectual functions. It is caused by permanent damage or death of the brain's nerve cells or neurons. Alzheimer's disease is the most common cause of dementia in people over the age of 65, and it represents about 60% of all dementias. The other common causes include vascular dementia, so this would be caused by stroke or by blockage of blood supply. We have dementia with Lewy bodies. We have alcohol dementia, which is caused by sustained use of alcohol. There can be trauma dementia, which is caused by head injury. And then there's a pretty rare form of dementia called frontotemporal dementia. The clinical symptoms and the progression of the dementia are going to vary. It depends on the type of disease causing it, and then the location and the number of damaged brain cells. So some types progress very slowly over a span of years, while others can result in a fairly sudden loss of intellectual function. So each type of dementia is characterized by different pathologic or structural changes in the brain. Some things we see are an accumulation of abnormal plaques and tangles in individuals with Alzheimer's disease, and an abnormal tau protein in individuals with frontotemporal dementia. Delirium, this is a serious disturbance in mental ability that results in confused thinking and a reduced awareness of the environment. The start is usually rapid, so it comes on within hours or just a few days. Some of our common contributing factors are going to be severe or chronic medical illness, changes in your metabolic balance, so electrolyte imbalances. There's some medications that can cause delirium both when you take them and also if you are withdrawing from them. We see it with infection. We can see it post-surgical, and then we can see it with alcohol, either intoxication or withdrawal. We all are probably pretty familiar with what confusion is. So it's just when somebody is off their baseline, they're not thinking clearly the way that they normally think. They may be disoriented. They may have an inability to make decisions. And we see confusion with both dementia of all types, and with delirium. some of the disorders that might contribute to dementia. So, Creutzfeldt-Jakob disease. This is a degenerative brain disorder that is going to lead to dementia and ultimately to death. It's like the human equivalent of mad cow disease. It's not actually linked at all to beef. It is marked by a rapid mental deterioration, usually within a few months. Most people eventually lapse into a coma. Heart failure, respiratory failure, pneumonia, other infections, they're generally the cause of death, and death usually occurs within a year. AIDS dementia complex, or we call it HIV-associated dementia. This is going to occur primarily in people with a more advanced HIV infection. So symptoms include encephalitis, which is inflammation of the brain. We see behavioral changes, and we see a gradual decline in cognitive function, which includes trouble with concentration, memory, and attention. The people show progressive slowing of motor function, and then a loss of dexterity and a loss of coordination. If it's left untreated, it can be fatal. And then the final stage of syphilis, which is known as the tertiary stage, this occurs in about 15 to 20% of people who have untreated syphilis. It is a slow progression, and it's a destructive infection of the brain and the spinal cord. Then we have some degenerative neurological disorders. So Alzheimer's disease we'll have a whole nother little video about. Pick's disease. So this is a rare disorder that instead of affecting many different parts of the brain, it causes a slow shrinking of cells in specific parts of the brain. So this is what we classify as frontotemporal dementia, because it is just an excess protein buildup which causes only the frontal and the temporal lobes of the brain to have dysfunction. Huntington's disease, this is a progressive brain disorder that's caused by a defective gene. So it causes changes in the central area of the brain, which affects movement, mood, and thinking skills. And then we have Parkinson's disease. In Parkinson's, the key brain changes are abnormal microscopic deposits that are composed chiefly of alpha-synuclein. And this is a protein that's found widely in the brain, but we don't yet know really what its functions are. And then we can also see some deposits of Lewy bodies, and these are also found in other brain disorders. We actually have a dementia with Lewy bodies that we consider as a separate disease. But we think that dementia with Lewy bodies and then Parkinson's disease might be linked to the same underlying abnormalities in the brain processing of this alpha-synuclein. All of the disorders that contribute to dementia have the same basic underlying mechanism. So it's the death or the destruction of actual brain tissue that causes the dementia. So with a TIA or with a cardiovascular accident, a stroke, you may have part of the brain that does not get perfusion, and those brain cells die. You can have your structural and your traumatic disorders. So normal pressure hydrocephalus, this is when you have excess fluid in your brain, and that is what these pictures are. So you have those brain ventricles, which are normally quite small with some fluid in them, but when you get hydrocephalus, you have a lot of excess fluid in there, which is pressing on and displacing that normal brain tissue, and that's what causes your brain dysfunction. The same thing's going to happen with a subdural hematoma. You're going to have blood leaking into space where normally brain tissue should be, and it's putting pressure on that brain tissue and causing it to not function correctly. Same deal with head injury and with tumors. It's actual structural damage to the brain tissue. Okay, so disorders that contribute to delirium. So as of right now, the pathophysiology of delirium is pretty poorly understood. We don't really understand its underlying mechanisms. It does, however, it represents a common and a potentially devastating problem for hospitalized people, especially if they're older. We estimate that anywhere from 15 to 56% of people in the hospital develop delirium, and then 25 to 33% of people with delirium actually die. So even if they survive, oftentimes, especially in our older client, this delirium kind of starts this cascade of events that culminates in a loss of independence, increased morbidity and mortality, and increased healthcare costs. We know that delirium might persist a lot longer than we previously believed. So some people are having symptoms that are present for months to years after the initial delirious episode. And they have documented long-term cognitive decline following delirium. Dementia itself is the leading risk factor for delirium, and at least 2/3 of cases of delirium occur in patients that have an underlying dementia or some type of cognitive impairment. We have some neuroimaging studies that have documented regions of hypoperfusion in patients with delirium, which suggests that delirium might actually cause a derangement in brain vascular function that can actually lead to dementia in some cases. Despite not really understanding the pathophysiology of delirium itself, we know that something is causing it. So if we can identify the underlying major illness, usually if you can treat the underlying illness, the delirium will correct itself. So if you can treat that electrolyte imbalance, it'll help with the delirium. If you can correct their hypoxia, it will help with the delirium. If you can correct their metabolic base disorder, it will help with the delirium. So the whole key to treatment is to identify the underlying disorder and treat that, which will help, hopefully, that delirium to correct itself. Some other disorders that can contribute just to confusion in general. So injury. We know that injury, like a concussion, a head injury, can make somebody confused. There are a lot of medical conditions, depending on how well they are treated, that can contribute to confusion. We know confusion is a side effect of a lot of different types of medications. Anything that is going to cause decreased oxygenation to the brain, of course, can contribute to confusion. We know that substance abuse, alcohol, any illegal drugs, along with our, legal medications, are contributors. And then if you have a fever, especially a relatively high fever, you can see some pretty profound confusion. So just quickly, I want to talk about concussions. So with a concussion, the disturbance of brain function is related to a neurometabolic dysfunction rather than an actual structural brain injury. So most people suffering from a concussion, they're going to have completely normal structural imaging if you try to do a CT scan or an MRI. Now, concussion or TBI, it may or may not involve a loss of consciousness. We used to think that if people didn't lose consciousness, they couldn't have a concussion, and we know now that that's completely not true. That more than 90% of concussions do not involve the loss of consciousness. We do know that they result in a constellation of physical, cognitive, emotional, and sleep-related symptoms, and that recovery is a sequential process, and our symptoms can last from several minutes to days, weeks, months, or even longer in some cases. So, following a concussion, there are some metabolic chemical changes that take place in the brain. Researchers believe that the force of the injury leads to a wave of energy that passes through the brain tissue, and it triggers this neuronal dysfunction. So it triggers dysfunction in the neurons. In most cases, this process is going to correct itself, and the majority of patients will fully recover. However, while the brain is still recovering, the reduction in cerebral blood flow can result in cell dysfunction that increases the vulnerability of the cell to a second insult. So that's why we say it is so important that if somebody has a concussion, that they rest and they stay out of sports until they are fully healed, because we don't want to add a secondary insult on top of what's already happening in their brain. 65% of concussions occur in children between ages of 5 and 18 years, and they are at greater risk for traumatic brain injury because their young brains are still developing and the tissue is not as able to recover as quickly as we see with an adult brain. As far as diagnostics, like I said, more than 90% of concussions do not involve a loss of consciousness. What they say is more important is memories of events before and after the concussion. Those are more accurate assessments of the severity. So if you can remember events before and after the concussion, it's likely to be low severity, versus if you can't remember anything around the time of concussion, we consider that to be more severe. So we're not really looking at loss of consciousness so closely anymore. So a few things for health promotion. We need to really be talking to our patients about the importance of wearing a helmet. So my general rule of thumb is if my body is moving faster than I could go if I was running, I need to wear a helmet. So if I'm on a bicycle, if I'm on rollerblades, whatever it is, if I'm going faster than I could go if I was running, there should be a helmet. We also want to make sure they're wearing them correctly. So this picture shows the right way to wear a bicycle helmet. And we want to be sure that the helmet they've chosen is appropriate for their activity. So this helmet is very appropriate for riding a bicycle. It is not whatsoever appropriate for riding a motorbike. So just make sure they have the right type of protective equipment. Everybody should be wearing a seatbelt. Kids need to be properly restrained. We need to make sure that car seats are secured correctly in the car. And then nobody should be doing anything exceptionally dangerous. So if you're riding your bike at night, make sure that you have reflectors. Make sure you have a headlamp. Make sure you're very visible. We don't want anybody driving under the influence. We don't want anybody riding under the influence either. So just kind of push these healthy behaviors that people can have to help prevent any type of head injury in the first place.